Absolutely. This is a very important conversation because it concerns your health. And there's been an outburst of people, not just in our country, Kenya as well. It started a lot overseas in European countries, from the Americas, the UK, and some of these developed countries where weight loss drugs that were originally meant to treat diabetes are now being used to transform people's physique into their, you know, doing body makeovers. And what you need to understand is that there's several drugs, some of those that are easily available. Originally, they are not found, even though still being manufactured. All right, I believe this is a very important conversation that should continuously be had because it concerns your health. And it just looks like there's an outburst of, weight loss drugs that are being peddled from over the counter to clinics to body spas where people are getting body makeovers of their dream physique. Now, you need to understand the several drugs. Mostly, they're actually meant to treat diabetes originally, but just people have found a way of overturning the situation around and now they're being used as weight loss drugs, something that was coined into a term called Ozempra, now Ozempic. Ozempic is when Oprah Winfrey, she just disappeared from the public domain. She went back to do her body makeover. And when she came out to the public, she looked thinner and slimmer than before. Something that, Oprah Winfrey, I think, has been one of those influential figures when it comes to weight watching. Thus, she has Weight Watchers. So you need to understand there's a weight loss drug, but this specifically meant to treat from the word is Wegovy. The drug is Wegovy, and it says it's a prescription once weekly injectable medicine used in combination with a reduced calorie diet and increased physical activity for chronic weight management in eligible adults and adolescents as well. Shockingly, it is also approved to reduce risk of major adverse cardiovascular effects from heart attack, stroke, death in adults with pre-existing heart disease and obesity or overweight. Now, it contains active substances of semaglutide, which mimics the naturally occurring body hormone, the GLP-1, that is glucagon, to regulate appetite, reduce food cravings, and slow stomach emptying. And the after effects of it, I'm going to mention, now that he's touching on stomach emptying, bowel movement, it could, most weight loss drugs actually affecting your bowel movement. Indications is prescribed for individuals mostly with obesity, overweight, as well as adolescents, maybe aged between 12 and older with obesity. Common side effects of Wegovy include nausea, diarrhea, vomiting, constipation, stomach, abdomen pain, headache, tiredness, or just literally fatigue. But the serious side effects include pancreatitis, inflammation of the pancreas, gallbladder problems, severe stomach problems, including gastroparesis, increased risk of low blood sugar, and then kidney problems due to dehydration from severe GL issues, seriously allergic reactions, and also increased heart rate. So you could likely to either get a stroke or a pancreatitis or bowel movement or constantly stay in, vomiting state and nausea. Well, let's look at another Ozempic drug just here. That one is Wegovy, and you've seen the in photographic of it. The other one is called Mounjaro, pronounced as it's Mounjaro, Mounjaro. So Mounjaro is a prescription once weekly injectable medication used to manage type 2 diabetes and for weight management in adults with obesity or who are overweight with at least one related health condition. So key facts about it as provided here by AI include mechanisms. It is the first in its class as a dual diagnostic mimicking two natural gut hormones, including glucagon-like peptide, GLP-1. You can see it's a common ingredient in both of these weight loss and diabetes drugs. And then it has glucose-dependent insulinotropic. These are medicinal terminologies. Polypeptide, GIP. This dual action helps regulate blood sugar levels, slow stomach emptying still, and suppress appetite, meaning that you'll have to starve yourself for you to attain it. And as you use these drugs, remember they still have massive body effects on immune system. Then administration, Mounjaro is administered as a subcutaneous under the skin injection. So it's an injection once a week in the abdomen, thigh, or upper arm using a pre-filled pen. And you can see those pens right over here. Related medication include Zepbound, contains the same active ingredients as cheese Cheesepadine. This is a very difficult medical terminology. Medical use and effectiveness. Mounjaro is used as an adjunct to diet and exercise, meaning that instead of and I think this is what's commonly available even in the Kenyan market. It's not even those Ozempic drugs. It's mostly Mounjaro because it's cheaper. And it treats type 2 diabetes. It is highly effective in controlling blood glucose levels of HbA1c and can be used on its own or with other diabetes medicines. Weight management in clinical trials, patients using the highest dose of Mounjaro for 72 weeks lost an average of up to 22.5% of their body weight as a result of comparable to bariatric surgery outcomes. Then here's the common side effects of Mounjaro. Common side effects and risks include gastrointestinal in nature, and tend to be mild to moderate or often occurring during close escalation. Common side effects still common with the other drugs as well. Nausea, diarrhea, decreased appetite, vomiting, constipation, stomach pain, indigestion. But then serious risks include boxed warning. Yeah, Mounjaro causes thyroidism. There's a disease called thyroidism. It's cell tumors in animal studies. It is known if this occurs in humans, patients with a personal or family history of medullary thyroid carcinoma or MTC or multiple endocrine neoplasia syndrome type 2 in men should not use Mounjaro. So it already comes with an explosive disclaimer. And then it causes pancreatitis, inflammation of the pancreas could lead to cancer. Hypoglycemia, risk of low blood sugar is increased if used with other diabetes medication. Contraception interaction. Mounjaro can reduce the effectiveness of oral birth control, pills, and additional barrier methods of contraception as recommended or 4 weeks after starting treatment. So I want us to finish with Ozempic drugs, so that all of them, you can see that the original treatment or the original purpose is to treat diabetes. The Ozempic drugs, it's a prescription once weekly injectable medication primarily approved for managing type 2 diabetes. You can see this is the third time diabetes is being mentioned. Originally meant to treat diabetes type 2. It is also used to reduce the risk of major cardiovascular events that include heart attack, stroke, or death in adults with type 2 diabetes, and not for heart disease to lower the risk of worsening kidney disease. Now, key information about Ozempic. That's why it's being called Ozempra. After Oprah used it. So the active ingredient is semaglutide, a glucagon-like peptide. Still a medical term. Mechanism of function, it works by mimicking the natural GLP hormone to help the pancreas produce more insulin when the blood sugar is high, reduce amount of sugar the liver makes, and also slows down food leaving the stomach. This helps to control blood glucose levels and reduce appetite, which is often leads to weight loss. So this is what people are rushing to actually purchase. Administration is a clear colorless solution that is injected under the subcutaneously, that is on the skin, in the stomach, thigh, or upper, or once a week using a pre-filled pen. So it also helps patients often lose weight when taking Ozempic. It's not FDA approved. Remember, Ozempic is not Food and Drug Association approved as a weight loss drug. A related medication called Wegovy contains